it's a privilege to catch up with Dr. Umang Mathur, the head of ophthalmology here at the prestigious Dr. Shroff Charity Hospital in Delhi.
My pleasure.
It's great to be here in your premise. And this is probably one of the few facilities in India where you have an absolutely vibrant ophthalmology group and an absolutely vibrant optometry group. And you've been here for many years?
Sure, 18 years actually.
Yeah. And is there a reason why both the groups are thriving here at this place?
I think it's basically because we complement each other. We recognized very early on what optometrists bring to this whole patient care. In India, unfortunately, we don't understand the need for the paramedic support. Most people on the streets would think that in a hospital there are only doctors and nurses. But the backbone in our hospital, I would say optometrists would be the backbone in the outpatients clinic. Right from refractions, history taking to all the specialized tests are all done by optometrists. And it doesn't end there. I think we are seeing optometrists understanding eye care is so high that whether it's for quality assurance systems, we find the best person suited is an optometrist.
Right.
A lot of administrative, community ophthalmology, they can participate in almost any field of the hospital.
And how does the flow actually happen in patient care? So a patient comes, and where does the optometrist fit in, and where does the ophthalmologist fit?
Right. So I would say in the clinic, I think about 80 to 90% of the work is done by the optometrist. So just after registration, it's the history, the refraction, applanation tonometry, preliminary slit lamp examination, decision for dilatation. A lot of them, in fact, can even take decisions for some of the specialized tests that are required. Why should the doctor see the patient twice? If the doctor can see the patient after topography, after the tests are done, after the biometry is done, the decision making and the information that the doctor has to make a decision improves so much. So more and more we're seeing that these optometrists do such a fantastic job. Like, I probably learned a little refraction during my residency. I have absolutely no confidence today in basic examinations and things because they do it much better than us. And then the doctor we know in our country with the population and the skewed doctor population ratio, should the doctor be doing things which they should be doing? And if something can be done better by somebody else, should they do that? So it's very logical. And the optometrists totally complement the work that we as a group do.
Right.
But it's important that we recognize that, acknowledge that, and position them properly. And I think that's important in a hospital. And maybe that's the reason why you feel that both the groups are thriving and are happy doing what they're doing. And by far, I would say the best thing about optometrists is the happiest group in the hospital.
That's
the most enthusiastic group. It makes the organization feel young. So they give you a lot of energy.
And one last question is, again, I mean, what you're doing here is phenomenal. You have a prime role in probably one part of India where the need is great, and there's not too many well-equipped hospitals available. But you also actually go to the rural parts quite a lot. I understand, you travel into interior Uttar Pradesh and other parts in Rajasthan. And what do you see the big needs there, and what do you see optometry doing to fill some of the needs which are there?
So if you look, refractive errors we know is a big vacuum. We need people who can actually not only do it themselves, but can optometrists become good trainers for vision technicians, for example. There's a role for all. It may be very difficult for a doctor or even an optometrist to go to the grassroots level. They sometimes are better qualified and can do much more in a slightly bigger setting. They need some infrastructure. The optometrists can become trainers, supervisors, and link everyone. And I seriously feel that that's a big role that the optometrists need to play today. They need to understand that beyond themselves, they need to spread their work. And for certain level, for simpler stuff, if we can reach out and train more people as optometrists or as vision technicians, and reach out and give primary eye care at the grassroots level.
Thank you so much for your time. It's been a pleasure chatting with you. Thank you.
Thank you. Bye-bye.